We'd like to present a check to the Evergreen School District for $7,500 to go toward the purchase of automated external defibrillators for really our most important assets, which are our kids.
The generous donation comes from the Quinn Driscoll Foundation, named after a student who died in 2009 during PE class from an undiagnosed heart condition. His parents started a foundation in his name to raise awareness of sudden cardiac arrest and to bring life-saving equipment to schools and organizations throughout the community.
First and foremost is just awareness, educating parents in our community about sudden cardiac arrest in kids. The second is to offer a screening program so that we provide the community a way to have their children screened for cardiac issues. And the third is to provide funds for schools, sports clubs, organizations to purchase automated external defibrillators or AEDs.
Sudden cardiac arrest kills close to 300,000 Americans every year. Surprisingly, many of the victims are children and young adults. Because minutes and seconds count during sudden cardiac arrest, having immediate access to an AED can mean the difference between life and death. That's why since 2005, Evergreen Public Schools has been purchasing units for every school in the district, with the final goal to have 2 AEDs in each school. A goal hampered by tight budgets, but now within reach because of the foundation grant.
Prior to the Quinn Driscoll Foundation, we had 2 AED units in each one of our secondary facilities, 1 in each of our middle school and 1 in each of our elementary school facilities. With the foundation grant, we are now going to be able to move to having 2 AEDs in each one of our middle school facilities, which gets it much closer to that 1.5 to 2 minute response time we'd like to see. And we're also able to add a second unit to McKenzie Stadium.
The importance of immediate access to an AED was highlighted at the beginning of the school year at Evergreen High School.
On the day of the incident, a student during freshman physics collapsed during class. The teacher called the main office to let them know she was having an issue. The nurse went running out towards the classroom to go provide assistance. A member of our security staff here in the building went and grabbed the AED that was close to the gymnasium and brought that into the classroom. And just as the nurse realized as she was doing vital signs that she needed the AED, it was there. She was able to hook up that unit. And after it did its diagnosis, it did provide a shock to the student and in essence brought the student back to life.
Greg Sanders of Northwest Health and Safety has been working with Evergreen Public Schools to install the AEDs and train staff.
Basically, if you can get the cabinet open, turn the machine on, get the pads on scan, the machine will take over and tell you what to do.
Attach defib pads to patient's bare chest.
At that point, we're going to access the pads. And this is what they look like, just like that. As soon as they're on skin, the defibrillators know it, and this is what they say.
Don't touch patient, analyze it.
It's found VFib, it's indicating I need the shock. This is the flashing shock button. Before a person's defibrillated, you make sure nobody is touching the patient, you yell clear, and you press the defibrillation button.
Shock delivered. Start CPR.
And at that point, you get on the chest and you start CPR.
In addition to fundraising for AED units, the Quinn Driscoll Foundation has partnered with Peace Health Southwest Heart and Vascular Center to offer in-depth heart screenings several times a year for only $49.
We leverage local cardiologists, volunteer nurses from Clark College and Washington State University, as well as volunteers from the Heart and Vascular Group. A student can go in and get a very comprehensive cardiac exam. I can't tell you the number of people that have come up to us and say, because of you, my granddaughter is alive. Because of you, we found out that my daughter has an issue.
In Evergreen Public Schools, quality education is a top priority, but so is the health and safety of every student.
When parents send their students to us, we act as their parents. And we want their own parents to know that they're safe and secure here and that the school district is doing everything that we can to make sure they're safe and secure. So if the student has a medical emergency and they're having a heart issue, it should hopefully be really nice for parents to know that we have those units ready and available, we have staff trained, and that we can literally bring a student back to life that has a heart episode while they're here at school.
For more information on the Quinn Driscoll Foundation and upcoming heart screenings, you can visit their website at www.quinn-driscoll.org. www.quinndriscollfoundation.org.